In this video, we're going to be going over a disorder called hemolytic disease of the newborn, or erythroblastosis fetalis. And basically, this is what happens when you have an Rh negative female who's carrying an Rh positive fetus can develop antibodies that destroy those fetal red blood cells. And these antibodies are against the Rh factor. Now, we saw earlier, most individuals are Rh positive. Only about 15% of our population is Rh negative. And when it does happen, it happens when you have an Rh negative female carrying an Rh positive fetus, because the blood cells don't normally mix between the fetus and the maternal blood. So you have the placenta where you have capillaries. These capillaries from the mother are going to come in and they're going to mix with the capillaries of the fetus. Well, nutrients and blood gases and proteins and antibodies can cross that placenta, but the red blood cells don't normally cross the placenta. Sometimes during a pregnancy, there can be some ripping of the placenta, some small tears that cause the blood cells to mix together. And if you have an Rh negative female carrying an Rh positive child, and so if the mother comes into contact with those Rh positive red blood cells, then her immune system reacts to those. And she starts making antibodies against the Rh factor. So her immune system has become sensitized to those Rh positive blood cells. This typically doesn't happen while the mother is carrying the baby. We typically have the mixing of blood at the time of childbirth. She makes these antibodies and they can go across and they can attack the red blood cells of the fetus, which is called erythroblastosis fetalis or hemolytic disease of the newborn. But fortunately, this doesn't happen too often during the pregnancy. When it typically can happen is at time of birth, when there could be tears in the placenta as the baby is born, and then that blood can mix together, and then she becomes sensitized. Well, once the baby's born, it's not going to have an effect on the newborn. It can have a potential effect on the next child, should that next child be Rh positive. So as I said before, those anti-Rh antibodies from the mother can move across the placenta and destroy the red blood cells, which can cause hemolytic anemia of the newborn or erythroblastosis fetalis. It usually takes one pregnancy to become sensitized, and the greatest chance of blood mixing is during an abortion, miscarriage, or delivery. And remember, it's the antibodies that can go across and attack the red blood cells. The red blood cells don't normally cross the placenta. Well, is there anything that can be done to prevent this? One of the ways that you can help to prevent this is by injecting an Rh negative female who's pregnant with an antibody preparation against the Rh factor. This can prevent this disorder, erythroblastosis fetalis, from happening. This antibody preparation, known as RhoGAM, and the GAM is short for gamma globulin, and the Rho is for the Rh factor, this should be administered before or soon after delivery, a miscarriage, or an abortion, just to make sure that she doesn't become sensitized to it. This antibody preparation, these antibodies bind to the Rh factor onto the red blood cells, have come across the placenta, and are now in her blood. And so the hope is that these antibodies bind to, they kill the red blood cells, they take out the red blood cells before she has a chance to become sensitized, before her immune system recognizes these as foreign and has an immune system response. As I said, most people, about 85% of our population, are Rh positive and lack the anti-Rh antibodies. So this can potentially only happen when you have an Rh negative female carrying an Rh positive child. And how often the RhoGAM shot is given to that pregnant female will depend on the doctor who's treating that female. Question for you. Well, what if you have an Rh positive female? Do you have to worry about giving the RhoGAM shot? No, you don't have to worry about giving the RhoGAM shot because she's Rh positive. And if she's carrying an Rh negative child, then there's no worry about anything happening with that child. She's not going to become sensitized and she's not going to make antibodies against that Rh factor. And just because you do have an Rh negative female carrying an Rh positive child doesn't mean it's automatically going to happen. They just give a RhoGAM shot as a precaution, just in case. Doesn't automatically mean every Rh negative female carrying an Rh positive child is going to develop antibodies. That RhoGAM shot is just given as a precaution, a preventative, to help prevent this from happening to the fetus and for future pregnancies. Let's test our knowledge. Go ahead and pause the video and select the term that makes the sentence correct. Here are the answers. Pause the video, select the term that makes the sentence correct. Here are the answers. And if you have any questions on this, please don't hesitate to let me know.